for something a little bit different. I don't have breakthrough drug delivery technologies. I don't have a treasure map. I don't have a Nature Biotech cover. But why don't we try moving forward nonetheless? I gave this title to Tony and the Milner team, and I was struck that they positioned me in the agenda as they have. So I need to follow Shankar and his personal experience with this dynamic and go immediately before Nubar, who will also tell his own story around this dynamic. So a bit of an awkward positioning, but let's get into it. And let's highlight Shankar. Shankar and his co-founder came up with the idea around incredibly high quality and high speed sequencing and celebrated it over at a pub not too far away at the Panton Arms, and then raced forward, navigated through a number of different financings, a seed financing, a subsequent Series A financing, did some key proof of concept initiatives around sequencing of bacteriophage, access the public markets, and then even launched their first product before eventually getting acquired by Illumina. An incredible success story, and one that went from a basic scientific insight into a commercial product. But that's not where things stopped. So once within Illumina, this technology continues to be the foundational NGS, foundational technology, and we all got to see the impact that sequencing technology had over the course of COVID. And as a result, helped to lay the foundation for rapid development of a variety of vaccine technologies that fortunately came to the fore, as well as helping us monitor and manage the pandemic as it evolved. So the ultimate example of aha to trivial, thank goodness. Similarly, Moderna, right? So Derek Rossi, a quirky biologist at Harvard, with some ideas around how to harness the capabilities of mRNA to transiently express antigens on target cells, teams up with Bob Langer at MIT, a consummate serial entrepreneur and drug delivery expert, and in turn connects with Nubar and others to co-found Moderna. And over the course of its development, had to navigate many different financing challenges, strategic shifts. Are we harnessing the power of this technology for anti-infective or more towards oncology uses? But once again, thank goodness, all of this work had been done as the pandemic starts to rage across the world. As a personal participant in one of the mRNA phase 3 clinical trials, I'm very thankful. As is the rest of the world, for the sorts of efforts that these innovators have done. Incredible stories. So let me tell you about still another innovation story, and it has many similarities to both Solexa and Moderna, with one difference. And that difference is it was an utter failure. So instead of delivering to investors incredibly compelling returns, it lost all the money. It was my money. Instead of harnessing the power of many, many different people, all pulling in the same direction to deliver an incredible outcome, it wasted a lot of time. And instead of impacting the lives of millions, it failed. It failed to do that. But nonetheless, it has a lot of similarities with Solexa and Moderna. So let me get into it. So similar to both the Solexa and Moderna teams, I too was interested in infectious diseases. And that's not an attractive area for venture investment in general. And I decided to turn up the unattractiveness still further by going after neglected tropical diseases. So neglected tropical diseases are a group of about a dozen infectious diseases. They tend to be endemic in the equatorial regions around the world and burden about 1 billion people on a year-in, year-out basis. It's an incredibly prevalent and heavy burden that the world carries as a result of these NTDs. So given that prevalence, why don't we have a ton of diseases or a ton of therapeutics for it? And the unfortunate reality is that the people who tend to suffer from these diseases and their loved ones that care for them tend to be poor. And so as we heard earlier with the LifeArc presentation, that results in a market failure. So not unreasonably do companies come to the conclusion that this is just too tough a nut to crack within the quarter-to-quarter earnings releases that they need to deliver on. So if the private sector isn't there to help, what about government? Well, I think we all have very recent insights into the dynamics in government, right? So as Rachel Reeves navigates the very difficult dynamics of balancing higher taxes versus spending priorities, and in particular domestic spending priorities, it starts to be very hard to allocate funds for things for public health in other countries. And you can see how that pressure comes to bear with a variety of different governments. Now, NGOs can also play a role here, and the Gates Foundation is a great example of that. But as was alluded to, those have those limitations. So how do we press forward? Not all is lost. And so one of the things we've alluded to a couple times is something called a priority review voucher, PRVs, excuse me. And so David Ridley was a health economist at Duke University, presented a paper on this idea around priority review vouchers in 1996. And the concept, as many of you know, is you can cut up to 4 to 6 months in the review cycle for having your drug reviewed. And if your drug gets approved for, say, a neglected tropical disease, you not only get the NDA, but you also get a PRV. And with that PRV, you can use it in the future to cut to the front of the line once again. Now, what's particularly compelling about these PRVs is not only the developer earns it, but they can then sell it. And so they can sell it to another drug developer who can value it perhaps differently from the way the original developer values it. It's striking to think that also, though this was developed in '96, by the very next year, this became federal law. And one of the magic elements of this piece of legislation was that it cost the taxpayer nothing, right? This was simply a transaction between two different drug developers and burdened the taxpayer not whatsoever. An incredible piece or an incredible example of the government working together with academia and thinking through novel industry policy. And indeed, this very fact that you could trade these PRVs started to showcase just how valuable this sort of inducement could be for attracting private industry to start to develop drugs for neglected tropical diseases. So the laws put in place by 2007. Within a few years, we start to get our first few issuances of PRVs, and then they start to trade. So the first one goes for a little over $65 million, and then up and up and up. So by 2016, we have PRVs trading at $350 million. And so now we have an opportunity to potentially do something here. Now, these PRVs weren't without critique. Aaron Kesselheim at Harvard was one particular ardent critic of PRVs in general. and I'd debate many of his critiques with him. But one of them was very fair, which was the lack of an obligation and the lack of follow-through of many of the drug developers to subsequently distribute the drug once it's gotten developed and received the PRV. So the social benefit, the whole reason the government put this initiative in place, was being undermined by the lack of distribution thereafter. Anyway, as a result of these swirling factors and some of these emerging trends, I started to wonder whether we could do something about this. And so the traditional thing when you have a philanthropic benefit and a financial benefit is to start to think about impact funds. Having been at a fund that did both life sciences and clean tech investing, I was well aware of some of the dynamics within these impact funds. And frankly, I'm also well aware of the critiques that impact funds sometimes run into. One of which is that you underperform on both dimensions. You don't deliver as much of a philanthropic benefit as would a grant receive, nor do you deliver as much of a financial benefit as would a traditional investment generate. And so the question was there still another model we could explore here? And so I started to think about, was there a hybrid fund as opposed to an impact fund? And specifically, can you create a construct where you go to financial investors and you make a straight up financial pitch, and anything having to do with the philanthropic benefit is a side effect. You simply have to make the financial pitch, and you have to be good enough to receive the money associated with the financial pitch. Similarly, on the philanthropic side, you make a pitch that needs to be good enough to pair up against what a grant might generate in terms of philanthropic benefit, and hold yourself accountable to both of those hurdles. And then have these two streams of work, however, work side by side together as you push forward on the objectives of the fund. So, and in so doing, can you generate even better financial returns and even better philanthropic returns? So to go from hypothetical to specific, now with the neglected tropical disease effort, you could say to investors, say, hey, for every dollar you give me, I'll get $1 from somebody else. And despite the fact that you're putting in just half the money, I will give to you 100% of the PRV value. And so let's go through the math. I'll show you how that's a good risk-adjusted return, but let's work through that. For the philanthropist, you say, listen, you put in $1, I get $1 from somebody else. And in spite of the fact you only putting in half the money, I'll give you 100% of the ownership of the NDA. And associated with that, you can dictate how that drug gets distributed, how it gets priced, and how it gets used in the various different ecosystems. Also, with the teams, what I'd like to do is recruit an entrepreneurial team to run the drug development, hunt for these drugs and run the drug development for these various different projects. And because I won't have IPO prospects or liquidity in that fashion in order to incentivize those teams, instead what I'd like to do is carve out, just as you would with any option pool within an equity structure, for the management team, say 15% of the PRV value, and allocate that to the team. So let me work through making that case to each of the stakeholders. So for the investors, you do the math around what an anti-infective phase 3 clinical trial in an NTD might look like, particularly if it's been de-risked, say in other geographies and in other settings. And then divide that in two, because the investor only needs to carry half of the investment costs. You then multiply that by the probability of success, which is obviously much higher actually than 50% in anti-infectives in late stages of development. And then at the end, you've got the PRV value. And so you can see how one could make a very compelling financial pitch to investors on this front. Similarly, with philanthropists, you could overcome many of Aaron Kesselheim's critiques, right? So now that the philanthropy owns the drug, they can dictate where it goes. so that it doesn't get misused. They can dictate what it's priced at. You can give it away for free, you can charge a very low price for it, or instead, you can even provide inducements to cause and encourage patients to adopt the drug. Not only that, but you can also think about other initiatives that you want to do around this drug distribution that will encourage its adoption and its broader social impact. So whether it's educating healthcare workers, having this drug distribution be integrated into broader societal initiatives that they're undertaking, training folks in manufacturing perhaps, all of these initiatives could all be integrated together with their broader philanthropic goals. And then finally, in terms of the management team, many here all know about Apollo Therapeutics, which is very much pioneering a hub and spoke model. Another company in California called Bridge Bio is undertaking this model where you keep the management team in a hub, and then you create spokes for each asset, and so that you can transact individually on those assets as they develop. And you could imagine this working quite well in this setting. And once again, each liquidity event with each of the PRVs would represent cash flow coming into the hub. So what became of all this? I know I already killed the suspense. It was an epic failure. And there's a variety of reasons, but the key reason is the change in the law. So the federal law changed, and from those nice $350, $338 million levels, it dropped precipitously. And the reason it dropped is because of the potential supply of PRVs skyrocketed associated with the change in law. And of course, that undermines the incentive that was being created. So, why am I talking about a failure in the context of the Celexas and the Modernas of the world? It's not a case of, false humility, aw shucks. I'm proud of this idea. I continue to be proud of the idea in spite of the failure. I actually think failures are important and relevant, and potentially have more to teach us about what it takes to move technologies from that aha moment to the thank goodness moment. I mean, you heard a little bit of it from Shankar when he alluded to, esteemed colleagues telling him not to do his work in G quadruplexes as well. There's something wrong with entrepreneurs. There's something wrong with people who just want to do it in spite of the fact that they see the hurdles ahead. And it's a wonderful flaw that entrepreneurs have, and it's one we should cultivate. And it's one that's incredibly important. I would argue that each of Celexa, Moderna, and my idea had totally obvious flaws and totally obvious reasons not to do it. And yet, because people chose to do it, we were fortunate enough to benefit from it. Let me just highlight also a few sort of general truths I think there is about failure. One is, why on earth would you be embarrassed about something that is so self-evidently going to happen very frequently, right? Any scientist, we all know when you do your experiments, you're not doing interesting experiments if you can always predict what the results are going to be. If you're on the edge, you're going to fail. You're going to generate negative results. And so why on earth would we be embarrassed when we fail in entrepreneurship as well? So it's just reality. It's also important, right? And once again, we have this challenge in the scientific literature as well. We tend to publish the positive results, but we don't publish the negative results as often. And that obviously creates flaws in terms of the papers that we're reading, et cetera, and so forth. But even when we do the meta-analyses that look across all the different pieces of work in a given area in the literature, it skews the meta-analysis because we don't have the negative studies in there. That's true in science. It's true in entrepreneurship as well. We need to look at the negative results as well. It will help to inform us and help us think through what to do next. The other surprising part for me is failure is interesting. You can talk to people about things that go well, and you have polite conversations and so on and so forth. But the level of follow-up is not comparable to what you have when you talk about your failures. There's something about I don't know what it is, there's some social grooming that goes on almost, where when you tell someone about your failure, you end up often hearing about theirs, and it's a much deeper and rewarding relationship, I find. So I guess the question is this normal? And I'd say it doesn't feel normal. So I've spent my professional career in San Francisco and Boston, and for whatever reason, that behavior is relatively normal. There's nothing special about me talking about my failures there. It's pretty darn common. And so some people would say, oh, well, Americans, as you picked up on my accent, they're different. They are different in a lot of ways. But I wouldn't say in this way. There's nothing American about risk tolerance. If you look at the entrepreneurial community in Boston and San Francisco, it's overrepresented with immigrants, including British emigres. So that's not it. It's not something inherent in the culture. But it is very prevalent in Boston and San Francisco, and I would argue it's something about the competitive environment. And there's something like this risk tolerance is a trait that's selected for. And it's emerged as a dominant trait as a result of that competitive environment. I don't know exactly why, but here I don't feel that as much. I don't feel the same acceptance of failure. And I was just at a conference in Berlin last week, and I heard presentation after presentation, whether it was from Germans or from French groups or Finnish groups or groups all around Europe, and they were all highlighting this same theme around culture and risk and so forth, and how it's not the same as what one would see elsewhere. So it seems to be a puzzle that many people are working through, and I would argue that the UK has an advantage. And not only the UK, but Cambridge in particular has an advantage in terms of addressing this challenge. Specifically, as I was alluding to, what causes this openness to risk tolerance, I used language that is sort of evolutionary biology, Darwinian even. So if any community can get a jump start on some of those concepts, I would sure hope that Cambridge would be at the top of the queue for doing that. I think secondly, just down the street, once again, not far from the Panton Arms, I popped into one of the wonderful museums here in Cambridge, the Polar Exploration Museum, the Scott Polar Exploration Museum. And you see this quote: "You'd be hard-pressed to say that the UK phenotype isn't prepared to take on risk in order to explore, uncharted lands. And so if we can't do it, who can? We just need to want to." With that, I look forward to questions.
couldn't agree more. That failure is a really important part of discovery. In fact, it's a fundamental part of the scientific process. But the question I would guess I would start with is, so one aspect of failure is learning from it. So if you were to do the same idea again, to try and solve that same problem, are there things that you've learned from that experience that you would take into trying it again in a different way?
Yeah. I mean, one was, so there's so many lessons. So one was I didn't move quickly enough. And so I would have accelerated more quickly. Frankly, one of the bits of feedback and resistance I had to my idea was that people thought the law was going to be repealed. Among them, people with very deep insights into the federal government, places like the Gates Foundation. And it turns out they were entirely wrong, right? The law didn't get repealed. It got expanded, which had the same impact as it getting repealed, but they were wrong. And so it's an example of you can just analyze these things so much and worry about it. But I think there was so much that we heard in the previous discussion with LifeArc and the issues they're working against, and bringing in more and more stakeholders that can also be a part of the solution. I tried to do a rifle shot and hurry up and get things done, but that can be fast, but it can also be risky and flawed.
Okay, speed, partnership. Okay, that's great. Are there any other questions from the audience?
So hi, so thank you very much for your talk and for being so honest with us. I wanted to ask what you learned from your failure, so this was already answered. But you say that unlike the US, the UK, and the rest of Europe probably is very averse to risk. How do we overcome this sort of behavior that we have? What would you suggest people to do to be less risk averse? How would you make this environment more better for and to take?
I really don't know. In summary, but seeing this quote, it just sort of slapped it out of me that there's anything inherent with this culture that suggests that it's not acceptable to take on risk in the name of exploration. My micro point on this would be to just talk about it, right? And just have it in all these one-on-one conversations, and then it would make it seem less strange.
Thank you.
One observation I've got about both, I think, the Boston and the San Francisco cultures is that there's an iteration of the management teams that go through biotechs, and I'm sure Nubal will talk about this as well, that there's a depth of experience and iteration, and therefore there's also a mutual support society, effectively, that exists. And I do wonder whether you think that that's something that we can try and enrich for here.
I think it's a great point. I think I remember when I was leaving grad school in the 90s in Boston and leaving to go to San Francisco, books were being written about how Boston lacked that quality, right? So in Boston, in the tech evolution, they created very much vertically integrated companies like Data General, digital equipment, and so on and so forth. While in Silicon Valley, there was a much different business model that was emerging that was doing exactly what you were talking about. And so one of the great critiques in those books was Boston was doing a terrible job, San Francisco was where it's at. So that was early 90s. When I returned back to Boston, 20 some odd years later, exactly what you described has happened. So much of that sort of lateral network that goes beyond your company turns out to be an incredible support network.
Yeah. One final question?
Yeah, so I was going to ask you, I mean, you've emphasised two sort of components really, a culture component, and I think in your kind of rule change or law change, a kind of nudge component from regulatory structures. Both of those you could argue were operating here, that, there's a question of culture in a place, and there's also a question of nudge from specific rules. Do you think we've got things to learn in the kind of biosciences sector from things like antitrust law, competition law, where if you actually want to encourage innovation, or you want to, in our case, let's say competition laws focused on creating rules that encourage competition across companies for the consumer benefit. You might argue that in a kind of healthcare setting, what you want to do is actually have rule structures in universities everywhere through the process, in government, that actually encourage innovation too, and that we haven't really thought about it that way, and that's why we don't really get the outcome we want. It's, it's neither the culture exactly, nor is it the rules exactly, it's that things are not tugging in the same direction.
So I couldn't see where that was coming. So it's, there we go. It's like coming from God. I'm early in my thinking on this, so I'd love a chat over drinks. So there's nitty-gritty law nuances that could be helpful for this. So non-compete provisions in employment contracts, are anti-competitive and sort of anti-entrepreneurial, right? And so thinking through those provisions is appropriate. I think one of the challenges one has is, I think a comparison with Boston and San Francisco, though I did it, is also unhelpful in a lot of ways, in that they're just different ecosystems, different environments, different stages of their development. And so we should think about a solution that's appropriate and specific to this arena. To go from that flowery words to specifics, I think ecosystems at earlier stages of development may need more pump priming, may need more coordination, may need more collaboration than the raw competitive environment that I'm alluding to. My suggestion is, as we do all that coordinating, we should watch out that we don't, as a result, undermine sort of the inherent risk tolerance that we need to cultivate as well.
Yeah, that's fine. I know there's one more question. Please, can you save it for the wine and the dinner later, because we need to move on to our final speaker. Thank you very much, Jim. Thank you. Right.